بسم الله الرحمن الرحيم. السلام عليكم أعزائي الطلبة. This talk about the chronic sinusitis. Chronic sinusitis is an inflammation of the sinuses lasting more than 12 weeks. The most important cause of chronic sinusitis is failure of acute infection to resolve. The most common organisms in chronic sinusitis are Staph aureus, Enterobacteriaceae organisms, anaerobic, and fungi. Causative factors and pathophysiology of chronic sinusitis is the inadequate therapy of acute sinusitis. This is the most important factor in chronic sinusitis. Acute infection destroys normal ciliated epithelium, impairing drainage from the sinus. Pooling and stagnation of secretions in the sinus invites infection. Persistence of infection causes mucosal changes, such as loss of cilia, mucosal edema, and polyp formation, thus continuing the vicious cycle. The signs and symptoms of chronic sinusitis. Rhinosinusitis symptoms and signs requires two major factors, or one major and two minor. The major symptoms are facial pain or facial pressure, facial congestion or fullness, nasal obstruction, nasal discharge, purulent or discolored nasal discharge, postnasal drainage, olfactory disorders like hypoosmia and anosmia, purulence on nasal examination, presence of a purulent nasal discharge within the nasal cavity, fever in acute rhinosinusitis only. While the minor symptoms of rhinosinusitis are headache, halitosis, bad breath, fatigue, dental pain, cough, ear pain or ear pressure or ear fullness. So for diagnosis of chronic sinusitis, we need two of major factors, or one major and two minor. The investigation of choice in chronic rhinosinusitis are A. Objective endoscopic signs. Rhinoscopy with rigid or fiber optic flexible endoscopes to examine the middle meatus and look for the following signs. Number 1, presence of nasal polyps. Number 2, presence of mucopurulent discharge. And 3, mucosal edema. B. CT scan of paranasal sinuses. The objective CT changes are: number 1, obstruction of the osteomeatal complex. Number 2, mucosal thickening or opacification of the paranasal sinuses. This is the endoscopical view of the right nasal cavity, shows the presence of the nasal polyps, which is one of the signs of chronic rhinosinusitis. The differential diagnosis of sinusitis are migraine, dental problems, trigeminal neuralgia, and suspicion of sinonasal tumors. Previously, we take the plain X-ray of the paranasal sinuses, and this is the occipitomental view. This is the occipitomental or Waters view of the paranasal sinuses, shows the maxillary sinuses, the ethmoid and frontal and sphenoid sinuses. This is the occipitofrontal view of the paranasal sinuses, shows the frontal sinuses with normal trabeculae or circulation, and the intersinus septum and the ethmoid sinuses. This is the lateral X-ray of the paranasal sinuses, shows the frontal sinus, the ethmoid, maxillary, and sphenoid sinuses. This occipitomental view or Waters view shows the right maxillary sinusitis. In cases when there is a suspicion of fluid level, we ask the patient to tilt the head and take the X-ray of the paranasal sinuses, and we see multiple fluid level within the maxillary sinuses. And this is complete opacity of the right maxillary sinus. Nowadays, we depend on the CT scan of the paranasal sinuses, and it is the investigation of choice in chronic rhinosinusitis. This is a coronal CT scan of the paranasal sinuses, shows the maxillary sinus, the ethmoid and the frontal sinuses, the nasal septum, inferior turbinate, middle turbinate, and the osteomeatal complex. This is a coronal CT scan, shows mucosal thickening of the maxillary and the ethmoid sinuses with obstruction of the osteomeatal complex. And this is the axial CT scan showing the mucosal thickening of the right maxillary sinus. And this is a coronal CT scan, shows opacity and mucosal thickening of the left frontal, ethmoid, and maxillary sinuses. This is a coronal CT scan, shows complete opacity of the right sphenoid sinus. And this is the axial CT scan, shows the opacity of the right ethmoid and the sphenoid sinuses. Treatment of chronic rhinosinusitis, either medical with the use of intranasal corticosteroid and short-term antibiotics and sometimes long-term antibiotics with saline nasal irrigation, and in the failure of medical treatment, we depend on surgical treatment, and the treatment of choice in chronic rhinosinusitis is the functional endoscopic sinus surgery. So the treatment of chronic rhinosinusitis are medical treatment of chronic rhinosinusitis, which includes intranasal corticosteroid, antibiotics, and saline irrigation. Antibiotics are an important treatment for chronic rhinosinusitis, such as the augmentin, cephalosporins, macrolides like clarithromycin or azithromycin, or doxycycline. With the use of intranasal steroid preparations, in common use are beclomethasone, fluticasone, and mometazone nasal sprays. We also use the saline nasal irrigation frequently. In a proportion of patients, surgical treatment is also needed when there is failure of medical treatment. The CT scan of the paranasal sinuses is providing a surgical roadmap, and the surgical treatment of choice in chronic rhinosinusitis is functional endoscopic sinus surgery, and the extent of the surgery depends on the extent dictated by the disease, and functional endoscopic sinus surgery provides good drainage and ventilation. The principle of functional endoscopic sinus surgery is to remove the polyp and the polypoid mucosa and widening of the ostia of the sinuses to improve the drainage and ventilation of these sinuses for recovery of the diseased mucosa with the preservation of the mucosa of the nose and paranasal sinuses as much as possible. Sometimes we do septoplasty when there is a severe septal deviation. What are the complications of sinusitis? We have many complications of chronic rhinosinusitis, and these complications occurs when the infection within the sinuses extend into or outside the bony walls of these sinuses. And the complications of sinusitis are the orbital osteomyelitis of maxilla and frontal bones, the maxilla in children and frontal bones in adult, the osteitis of the diploic bones, and the mucocele, which is a mucus containing cyst, and the most common site of mucocele in the ethmoid and frontal sinuses, with the loco-regional complications like pharyngitis, tonsillitis, laryngitis, and otitis media, and the intracranial complications like meningitis, intracranial abscess, especially the frontal lobe abscess, and cavernous sinus thrombosis. The orbital complications of sinusitis are periorbital or preseptal cellulitis, the orbital or postseptal cellulitis, subperiosteal abscess, orbital abscess, and cavernous sinus thrombophlebitis. If patient with sinusitis presented with one of any of the following signs of complications, and the signs of the complicated chronic rhinosinusitis are presence of generalized persistent headache, vomiting, convulsions, chills or high fever, edema or increasing swelling of the forehead or eyelids, blurring of vision, diplopia, or persistent retroocular pain. These are signs of the orbital complications, signs of an increased intracranial pressure, personality changes which occurs in frontal lobe lesions, or dulling of the sensorium. This is a right preseptal cellulitis with eyelid edema and erythema. This is another case of preseptal cellulitis. And this is the orbital cellulitis. And this is a case of osteomyelitis of the frontal bone. And this is called Pott's Buffy tumor. And this is the frontoethmoidal mucocele pushing the orbit downward and laterally, the most common site of the mucocele in the frontal and ethmoidal sinuses. And this is the fatal complication of sinusitis, is a cavernous sinus thrombosis. This is a life-threatening condition and should be treated as early as possible with heavy dose of antibiotics. The patient present with impairment of the consciousness with high fever and rigor, proptosis, chemosis, edema of the conjunctiva, blindness, and ophthalmoplegia. And this condition should be treated as early as possible with heavy dose of antibiotics. Good luck.